My name is Ahmad Alturjuman. I practice interventional cardiovascular medicine in Temecula, California. Most of my work is done at Temecula Valley Hospital. They always ask me why do I practice mostly here at Temecula Valley Hospital, including my patients. And I basically tell them that I have been having a great experience. The cath lab personnel and the cardiovascular personnel here are very helpful. They are very knowledgeable, and they provide an excellent care to the patients here. The cath labs have all the equipments that we require to perform cardiovascular procedures. The management, the staff, everybody have been very helpful, professional, and pleasant. I really like what I do because when I'm taking care of a patient, fixing their heart, fixing their blocked arteries, or putting pacemaker defibrillators, or taking care of their peripheral vascular disease, now they are able to perform their day-to-day activity without having difficulty. They are able to walk without having pain in their legs. They're able to breathe and enjoy walking with their significant others, able to sleep comfortably. Patients feel better, and that's very rewarding for us. Also, when patients come to the hospital with heart attacks, we go in quickly and open the artery, restore the blood flow to the myocardium. Coming outside the room and talking to the family, everybody is very happy. They're very appreciative of what we do, and that's really enjoying to us and rewarding. That's why I really like my profession. People ask me a question always like, why did I become a cardiologist? My dad, when I was in medical school, specifically 5th year, my dad developed heart disease and unfortunately had a heart attack. And I was involved as a student, medical student, I was involved in his care with the cardiologist. And that really inspired me to become a cardiologist because I wanted to help him. Also, I like cardiology because it's a dynamic field. There's always new information, there's always new research, there's always new equipment, new medications to treat a variety of cardiovascular illnesses, and it makes it interesting. In my free time, I usually like to play soccer. I play soccer every Monday night and Wednesday night. Then we have 2 games. And I played soccer all my life since I was a kid. And I carried this through my medical school, my residency training, cardiology training, and in my private practice. Then this has been very rewarding, keep me healthy and strong. Patients always ask, and even friends and families, and what do we do to keep our heart healthy? And I tell them that number one, the most important is exercise. You really have to exercise. And I don't care if you have knee pain or other reasons, there's always a way to exercise. Then people who don't have any significant, knee problems or joint problems, the best exercise in my mind will be a brisk walking, 30 to 40 minutes, 5 days a week. Patients sometimes tell me, well, doctor, I have knee problems, I can't do it. Okay, fine. Just buy a stationary bicycle and do it at home. And some other people say, even I can't pedal because of my knees or my legs. I tell them, okay, fine. Just buy an arm stationary bicycle. That will do the same thing. Then that's number one. Number two, eat healthy. And my recommendation always to eat several times a day, 5 times, 6 times, it's okay, but just small portion and healthy food. Try to avoid red meat, avoid heavy, rich food, And we always talk about trans fat, then popcorn, French fries, even coffee mate, other products, preserved meats, very bad. Then try to avoid that. Eat as much vegetables as you want. I really don't care how much you eat. That will help you, especially leafy green vegetables, very helpful. Fruits, you have to be careful. Just eat in moderation because it has sugar and calories. The third thing is supplements. Be careful. Most of the advertisements on TV and on social media, it's all marketing. I personally feel that if you have a healthy, balanced diet and you exercise and you're exposed to the sun, in moderation, you really don't need much of supplements. But if you really want, I would say fish oil, you can buy it from any place, 1 gram every day. Vitamin D, there's really not much of proven research that these all is going to help the heart or the vascular system. But out of all the supplements outside, I would say vitamin A and probably vitamin D. Other natural supplements like, food, like beets. Beets supposed to be good for your blood pressure and supposed to be good for your heart. Blueberries are good because they have antioxidants. And some other, I like to recommend banana. Banana is rich in iron, low in cholesterol, rich in potassium, and more importantly, has a lot of fibers. Fibers are very good for healthy digestive system and also lower your cholesterol. Basically, just eat healthy, avoid binging. Sometimes people will eat only 1 time a day, but then they eat a large meal, and that's very bad. I would say number 4, you need to drink a lot of water. Water is very important. In order to burn the calories, you need the fuel, and water is your fuel. I would say for women, an average age and weight woman should drink at least 80 ounces of water on a daily basis, and for men should be 100 ounces. Avoid smoking, that's very important. When it comes to alcohol, if you don't drink, I do not recommend you to drink alcohol. Yes, alcohol does have some benefits on your vascular system, but alcohol does have negative effect on the other cardiovascular component. It increases the risk of cancer, especially head, neck, and sometimes colon, bladder. Then if you drink alcohol, I recommend to drink in moderation, and that usually 1 drink for women, 2 drinks for men on a daily basis.